After being criticized for being too cautious, the CDC has done an about-face on masks. So why the change? Turns out the vaccines are that good. Let's connect the dots. Some of the criticism the CDC has faced was it was underselling vaccines by not allowing vaccinated people more freedom. That's because the data we now have on the COVID vaccines shows they are extremely effective in preventing severe disease. Experts now have more than just the results of the clinical trials. They have real-world data. The initial trials show the Moderna and Pfizer vaccines were at least 95% effective, with Johnson & Johnson's more than 70%. And when it came to hospitalization and death, they were close to 100%. But what happened in the real world? Israel had one of the most aggressive vaccination campaigns. It found Pfizer's vaccine was about 90% effective overall, even better at preventing severe illness, meaning Israel's daily new cases have fallen 95%, and daily deaths are in the single digits. One reason the CDC was cautious was because of concerns that even vaccinated people could still spread the disease. But as more shots are going into arms, it is looking like that is not the case. One real-world study found the Pfizer and Moderna vaccines help prevent transmission, not just symptoms. So now the focus moves from face masks to encouraging everyone to get vaccinated.
So remember, you can send any vaccine questions you may have to the number on your screen, 404-885-7600.